the right hair transplantation technique for you may be difficult, so in this ensuing video, we will be talking about the differences between FUT and FUE, which are the two main methods for hair restoration, and then deep dive into it to see the various factors that make one option maybe a better selection choice for you. Surgical hair restoration is basically a cosmetic hair improvement procedure where you harvest DHT-resistant hairs from the back and the sides of your scalp and move them forward to an area of baldness or an area of need, such as, for example, the frontal scalp, the vertex, the crown, and also other areas on the body, such as the beard area or the brow. Now, there are two main methods that are used to achieve this, namely Follicular Unit Transplantation or FUT, strip harvesting, which is what is also known as well as Follicular Unit Extraction, which is FUE for short. FUT or Follicular Unit Transplantation is also known as strip harvesting for short. Now, strip harvesting is the older technique of hair transplantation and it involves the surgeon actually harvesting a whole strip of hair-bearing tissue from the back and the sides of the scalp and then stitching the donor area back up into a single linear scar. Now, this involves actually having good laxity over the back of the scalp because as a candidate, if you have very poor scalp laxity, this will not allow your surgeon to harvest a good amount or good width of strip tissue in order to get a good size hair transplantation. If there's a lot of tightness, this can also give rise to a spread of the scar tissue, especially if there is a bigger strip of tissue harvested, then there might be tension within the scar line and a bigger scar spread. Now, when this strip of tissue comes out, it is not the end yet. There needs to be a very good group of trained hair transplant technicians that can then process down these grafts. Now, this is coming out almost like a bread loaf. And then what the technicians do is to sliver that whole strip of tissue into individual columns, and then from that individual slivers, they cut down the grafts further into individualized family units. Now, these follicular units or family units actually range from singles, doubles, or triples, and then these are then sorted out in a petri dish into different sizes before they are kept chilled in a cold holding solution. Now, from the cold holding solution, then the transplantation into the donor site will be very similar to FUE process as well. So the key difference here for FUT versus FUE, as you will realize, is a method of harvesting. FUE is a different procedure. It's a more modern or newer technique where you harvest individualized follicular units directly from the donor area. So this involves the surgeon taking a small cylindrical punch. This can be mechanized or even using a robotic device such as the ARTAS robot, for example, to harvest individual follicular units from the donor area. This usually involves you having to short shave the area over the back for you to adequately get the cylindrical punch over the hair follicles without transecting them. So these individual follicular units are then teased out using a fine pair of forceps and then again likewise sorted out into the groups of families they belong to, the singles, doubles and triples, before they are finally placed back into the recipient area. So do note that the key difference between FUE and FUT, as I mentioned, is the method of harvesting. So again, like with FUT, which requires stitching, FUE does not require stitching. Each individualized harvested area basically closes on its own without any stitching required. So this tiny 0.7 to 1 mm diameter small individual incisions will close up on their own over the ensuing 5 to 7 days, giving rise to very, very tiny, barely perceptible scars. So this allows you to keep your hairstyle much shorter than you do in a linear strip harvest, where the linear scar is maybe more visible if you short shave your hair. The key differences are as follows, right? So for FUE and FUT, first is how short a style you can keep when you're going through a harvesting process. So with FUT, which is strip harvesting, you can leave a long hairstyle because this can cover over your linear strip scar after it's stitched up. So typically, it doesn't require you to buzz cut or short shave the hairs at the donor area. FUE, for example, on the other hand, requires you to shave or clip your hairs really short for the harvesting to take place. 2 is a recovery time as well. Now with strip harvesting, this is a surgical process where there's going to be a linear scar that's stitched up and sutures come out between 10 to 14 days. So the healing window for the donor area will be typically about 2 weeks, and after that there can still be some pain or discomfort over the donor area for a period of time. And this is because this is a stitch scar and it's a long stitch scar. On the other hand, FUE basically involves just tiny incision holes that are made over each individualized follicular unit, and this closes up without any stitching. Hence, the recovery time over the donor area can be anything between 5 to 7 days and is relatively painless and has an easy, quick recovery. So functionally speaking, you can get back to activities and also physical exercise much quicker than FUT hair transplantation. Now, other than the two differences I mentioned above, it's also possible to think about it from a standpoint of how many grafts are required. Now, for FUE, typically, because it is a slow process, for harvesting, if you're going to harvest 1,500 to 2,000 follicular units, this is going to take a number of hours ranging from between 6 to 8 hours. Now, for FUT, the whole harvesting process can be much shorter and just take an hour and a half for the harvesting process to be done. But of course, there is also the time required to process the grafts after, which is not taken into account. Now, so for strip harvesting, the time that a patient takes to lie face down for the strip harvest is a lot quicker than the time required for a patient to do a mega FUE session where you need to lie face down and harvest every individual follicular unit hand by hand. So one is the total surgical time, which is definitely going to be longer with FUE hair transplantation. So the other thing to think about is also possible the kind of scar that you're going to get. So with a linear scar, you're going to get a long linear scar that potentially could be very fine but may also be widened if there's high tension in that area, and also sometimes in Asians there can be increased scarring compared to in Caucasian scalp type. But on the other hand, FUE gives you very scattered, small, imperceptible scars. So if you distribute the scars evenly over the back, you hardly can perceive that unless you really go bald and really short shave your hair. You might be able to see tiny white scars or small white discolorations scattered across the back. So another key difference is also the visibility of the scar and the subsequent kind of hairstyles that you can keep. So with FUE, you can typically go a lot shorter, and for male patients with FUT, you might have to keep a longer hairstyle and not go so short over the back, otherwise that linear stitch scar is going to be quite perceptible. Again, the hair transplant technique depends on the type of extent of hair loss that you have and your lifestyle considerations. For example, sometimes if you're really going to have a very short style, then FUE might be a better choice for some male patients who like to actually short shave the back of their heads so it's less visible and easier to camouflage downstream. 2, if you only need a small number of grafts, then definitely FUE will be a better technique, because with FUE, you can just harvest a few grafts as needed, for example, for a simple eyebrow transplant or some beard area transplantation, for example. You might not need such a big session for transplantation, and you can also individually select the grafts. Now, the key thing here is with strip harvesting, you can't quite select the kind of grafts that you're going to get. When you harvest that whole strip of tissue, whatever comes up will be utilized. Now, with FUE, you can actually cherry pick your grafts, which means that if you really want to do just brow transplant and you only want single hair follicular units, you can individually choose and pick out the strands that you want to select one by one. And so that gives you more precision control when it comes to small areas of transplantation. The other thing to note as well is your lifestyle and your recovery time frame. So if you're an athlete and raring to go back to active physical lifestyle, then FUE might be an easier process for you to recover from because of the recovery time being shorter and less pain post-operatively speaking as well. It is easier to get back to active lifestyle. It's sort of like a woman with maybe the choice between a normal birth and a cesarean section. For example, with a C-section scar, it's also a long linear scar. The post-op surgical pain and managing that long scar is going to be more challenging than a normal vaginal delivery, for example. Hence, likewise, a strip harvesting is also a long linear scar. There's a little bit more downtime and recovery process when compared to just a follicular unit extraction. You basically feel much less pain and easy recovery within a week or so for the back donor area. So I also think that you need to look at the age group of the patient as well. For example, I would say that if you are a young male patient suffering from quite progressive, extensive male pattern hair loss at a young age, then you might want to delay your transplant till you stabilize your hair loss medically, because it's important to first stabilize that. Otherwise, it can also be a form of hair loss that is so progressive that hair transplantation basically cannot make up for the difference that you get in your lifetime. So I think it's also important to look at the gradient and the extent and pace of hair loss before determining if a transplantation is suitable for you at that stage in your life and how much grafts you can afford to spare for that area of correction as well. So in this video, we talked about the differences between FUE and FUT hair transplantation. It is important to work with the right surgeon who has skill sets in both for you to be able to select the right option for you, and sometimes even a combination approach may be required. Some patients may go through both a strip harvesting as well as a combination with FUE downstream for the second or third hair transplantation. So work with a surgeon that has expertise and understands both procedures, work with a surgeon that also has expertise in medical management of hair loss so you can optimize the survivability, and also sometimes you may not even need a hair transplantation. If that medical hair loss can be treated appropriately, sometimes there can be adequate restoration and you may only need maybe a small transplantation to fix a certain area of loss like the anterior hairline. So I always say that choosing the right surgeon and also then determining the lifestyle of a patient and understanding the underlying disease process and lifestyle factors are important to ensure a good outcome overall. And this then is important to translate over a lifetime of management, because hair loss doesn't just stop at one time point in our lives. With HAA, which is really common, it is a progressive hair loss disorder that happens over decades. It's important to know all these factors and take into account all these considerations before embarking on hair restoration surgery. Thank you for watching to the end of this video. I'm Dr. Angeline Yong, a dermatologist and dermatological surgeon that subspecializes in medical and surgical hair restoration. As a hair transplant surgeon, I'm here to answer some questions that you have. So if you have any burning questions, don't forget to drop them in the comment section below and follow us on all our social media channels. Thank you.